Now, one of America's biggest drug problems involves substances that are illegal. The Obama administration today unveiled a plan to cut prescription drug abuse by 15% over the next 5 years with the help from pharmaceutical industry participants. Now, let's get some details. My guest is Gil Kerlikowske. He is the director of the White House Office of National Drug Control Policy. Mr. Kerlikowske, welcome to Bloomberg. What exactly is the problem? This has to do with prescription drugs, and apparently the problem is worse than overdoses that were previously associated with things like crack cocaine. Explain the problem.
Sure, it's very serious. The number of people dying as a result of prescription drugs or being led by prescription drug overdoses is greater than from gunshot wounds in this country. In 17 states, those deaths exceed those from car crashes, so you can clearly see the problems that it's causing. And we think we have a plan being rolled out from this morning that is going to deal with it.
Now, is this a problem resulting from the way that doctors prescribe medication? Because if these pills are only available by prescription, you'd think that they would be controlled. Or how are these people getting the drugs?
Well, nothing in the drug policy world is actually simple, and this one is particularly complex. So it can involve doctors who may be overprescribing. That's a small number. It can involve patients who are doctor shopping. It can involve young people who are initiating drug use or abusing drugs through the medicine cabinet rather than buying something from behind a gas station.
Does it also involve pill mills, this idea that there are companies or organizations out there that are illegally producing prescription drugs?
The pill mills are more about doctors, and this is particularly the epicenter of South Florida, the Broward County area. Doctors who are writing massive numbers of prescriptions to people, and in fact a number of people from Appalachia that would travel down there for these very powerful, very addictive painkillers. So you're right, that's just one other gateway into this problem.
So what is the proposal part of the Obama administration to deal with this?
Well, the proposal is very comprehensive. It's not just a criminal justice problem or a public safety problem. It's also an education and a public health problem. So we have several proposals. One would be to move for mandatory prescriber education. That means that all of the doctors who can prescribe these very powerful painkillers have to have a certain amount of training. The other part would be to make it easier for people to be able to get rid of the prescriptions that are in their medicine cabinets. We also are very much supporting prescription drug monitoring plans. These are in 35 states. They're databases that help pharmaceutical boards or medical boards identify doctors who may be overprescribing or patients who may be doctor shopping.
Just to take the issue of doctor education, is it really a question of whether the doctors know what they are prescribing could fall into the wrong hands, or that they indeed know and they're benefiting?
No, there are very few doctors in that last category, and those that are clearly doing that are violating not only their oath of office, they're also violating the law. And we've seen indictments and prosecutions in different places around the country. But in medical school, as I've traveled to medical school, as I've talked to physicians, you find that doctors don't get a lot of the information they need about some of these very powerful painkillers. That's why mandatory prescriber education is going to be particularly important.
What about the growth in prescriptions in general? Hasn't that also been something that you're going to have to deal with?
Well, there has been a growth, and that goes back to about 10 or 11 years ago. It was widely understood and that we were not, or the medical profession was not adequately treating pain. What we saw was, over this period of time, a massive increase in the amount of prescriptions being written. The pendulum, at least in my opinion, has swung a bit too far, and now we have to right-size it, and we have to deal with this in a comprehensive way, and that's exactly what this plan does.
We've got to leave it there. Gil Kerlikowske, thank you very much for joining us, the White House Drug Control Administrator.